Today we at SPARSH Hospital will be talking about what is laparoscopic surgery. In conversation with us is Dr. Geeth Monnappa, who is a Senior Consultant Obstetrics and Gynaecology. So Dr. Geeth, what is laparoscopy?
So laparoscopy is a minimally invasive procedure where instead of making a 10 centimeter long incision and opening up the abdomen in order to remove a diseased pathology, we do the same procedure with minute incisions made on the tummy, the maximum being 1 centimeter long, through which we introduce a laparoscope, which helps us visualize the entire abdominal cavity. In addition to this, we make minute 0.5 centimeter nicks on the tummy, maybe 2 or 3, and introduce additional special instruments that help us remove the disease pathology. So we basically do the same procedure that is done through an open large incision with the help of minute incisions using laparoscopic instruments.
So doctor, what gynecological surgeries can be done through laparoscopy?
So any surgery that can be done through an open procedure can be done laparoscopically, other than a cesarean section, of course. One of the first gynecological procedures that was done laparoscopically was a tubal sterilization. Removal of ovarian cysts can be done laparoscopically. You can remove fibroids or adenomyomas, which are nothing but non-cancerous growths in the uterus. Hysterectomy can be done laparoscopically. Endometriosis can be evaluated, can be diagnosed laparoscopically and treated at the same time. Surgeries for prolapse, that is when the uterus tends to descend down, can be done laparoscopically, but I'm an advocate of vaginal surgeries for prolapse. Stress urinary incontinence, a very common condition that women experience after the age of menopause or even after childbirth, where post-cough, women tend to experience leak of urine. This can be treated laparoscopically through a simple stitch. So most procedures that can be done via an open surgery can be done better laparoscopically with better recovery, a faster recovery, less post-operative pain, and definitely better cosmesis. We also see that patients tend to get back to their normal activities much faster post a laparoscopic surgery as opposed to an open surgery.
So doctor, you've almost answered my next question, which is advantages of laparoscopic surgery. How big is too big in laparoscopy?
Talking about the advantages of laparoscopic surgeries, the main advantage of laparoscopy is that we use minute incisions rather than one big incision to do the entire procedure. So patients experience much less pain as opposed to an open surgery. The recovery is much faster. Of course, it's a cosmetically appealing scar as opposed to a 10 centimeter long incision. We see less adhesions post a laparoscopic surgery. So if you have a woman who's undergone an open surgery and another who's undergone a laparoscopic surgery, if you open up the two women at the same time, you will see that post laparoscopic surgeries, the chances of adhesion, that is the tissues getting stuck to each other, is much lesser as opposed to an open surgery. This is mainly because we don't handle the tissues too much when we use laparoscopic instruments, and because of the better magnification that we have with the laparoscope, surgeries are very fine. And this leads to less blood loss, and less tissue handling invariably leads to less adhesions. So when patients tend to experience chronic pain post-surgeries, this is often due to adhesions, which is much lesser post a laparoscopic surgery as opposed to an open surgery. Blood loss is much lesser post a laparoscopic surgery, again because of better magnification, better visualization. We tend to tackle the blood vessels much better as opposed to an open surgery. And we often find that we hardly need to give blood transfusion post laparoscopic surgeries.
So doctor, that would lead to my next question. What are the disadvantages of laparoscopy?
Laparoscopy definitely has a longer learning curve as opposed to an open surgery, which is why you will still find a lot of doctors advocating open surgeries over laparoscopic surgeries. Laparoscopy will take a slightly longer duration as opposed to open surgeries, especially when we deal with large abnormalities. In case of a large uterus or a large fibroid, when we have to remove the entire organ vaginally, we have to do so by making multiple pieces of the organ so that it can be retrieved through the minute incisions that we make or through the vagina. So this can take slightly longer than an open surgery.
So doctor, what is the use of a Marsilator, and is it safe to use one in a laparoscopic surgery?
So a Marsilator is an electrical equipment which helps us break down the tissues into thin strips and thus allows us to remove large abnormal organs through minute incisions or through the vagina. A Marsilator is an electrical equipment, and as we cut the tissues, we also end up disseminating small amounts of tissues to the rest of the abdomen. So in case we're dealing with undiagnosed cancer, or in cases of large fibroids where there could be an element of a cancerous change within a fibroid, this could lead to spread of the cancer, and this could lead to a reduced survival in the patient. So in cases of large fibroids, or if we notice that a fibroid has been rapidly growing, or in cases of postmenopausal women who come to us with a sudden increase in the fibroid, it's always preferable to do an open surgery if the fibroid is way too large for it to be removed through the vagina. So in case of fibroids that require morcellation, it's very, very important to know that we're not looking at a cancerous change in the fibroid before we use a Marsilator. Or if we use a Marsilator, it's always safer to do an in-bag morcellation to prevent spread of tissues into the abdomen.
So what should one expect post-laparoscopic surgery?
So in general, post-laparoscopic surgery, women tend to do much better as opposed to an open surgery. The recovery is much faster. They may tend to have a little bit of pain for the first few days post the laparoscopic surgery. A patient may experience slight bloating soon after the surgery because of the wind being trapped inside. They may also experience shoulder pain because of the gas that we use to distend the abdomen, which generally disappears within the next few days. Ambulating early, that is, if you ask a patient to walk around and have plenty of liquids, that helps in the patient to feel less distended and less gassy. We also give them certain medications to help them move bowels, which helps them feel lighter. So a little bit of vaginal discharge for the first 2 weeks, a little bit of bloody discharge for the first 2 weeks. A patient is expected to stay in the hospital for 24 hours to 3 days post-surgery, depending on how complicated the surgery is. The stitches that we generally put at the end of laparoscopy is absorbable and does not require removal. Recovery is generally much faster post-laparoscopic surgery as opposed to an open surgery.
Doctor, we know that a lot of women today go for laparoscopic hysterectomy. What are the warning signs that one should look out for before opting for a laparoscopic hysterectomy?
So your gynecologist will decide which is the better method of surgery, either an open procedure or a laparoscopic procedure. No size of the uterus is a deterrent for a laparoscopic surgery, but in case of a very large uterus that occupies the entire abdominal cavity, sometimes placing ports can be difficult, visualization of the entire organ can be difficult, and the surgery per se may be a little more difficult, and therefore a doctor may suggest an open surgery. As I mentioned previously, in case of a large fibroid or a rapidly growing fibroid where there is a suspicion of a cancerous change within a fibroid, because we still do not have adequate imaging modalities to diagnose cancerous change in the fibroid. In these cases, again, a doctor may opt for an open surgery as opposed to a laparoscopic surgery. However, most surgeries should be done laparoscopically because laparoscopy offers numerable advantages over open surgeries and should be the preferred method of hysterectomy for every woman.
Thank you so much, doctor.